Hey everybody. So first things first, I just wanted to apologize because clearly I have not been posting a lot as of late. Um, I've been getting a lot of private questions, private messages, which is phenomenal. Please keep them coming. I believe, hopefully, I am all caught up on those. I will let you know that a few of them were going to my spam box in my email. I think I caught all of them. It's very possible that I might have missed some though. So if you sent me anything and didn't hear back, please send it again. I would love to hear from you. So I've been trying to respond to a lot of those private conversations. Um, and also, if I'm being completely honest, I've had a few down days with my depression lately. So, talking about mental health in front of a camera has been rather difficult. But um, here we are, jumping back on the horse. So, uh, a lot of the private questions I've been getting have been very similar. So, I wanted to just touch base on a general topic. And even if we go over everything that you want to ask me today, you can still ask me again in private. It's fine. Because it's been such a high frequency that I'm getting the same question, I thought I would address that. So, um, a lot of the questions I've been getting have been from people who live in rural areas like mine, Southwest Iowa. Not a lot of providers. When there are providers, they're almost always a good drive away. So, in that situation, how do you start mental health treatment? And I wish I could tell you that the situation was better than it is, but we have to make do with what we have. So, and again, this is just my personal opinion. Um, most of what I'm going to say today is based on personal experience and some work experience. Um, and I am by no means an expert. I'm just letting you know what has worked for me and what I've seen work for other people. So, um, okay, starting out, let's say you're concerned you have a mental health issue. You're finally ready to reach out. First of all, yay, I'm so proud of you. Please do it. Um, but where do you start? It's confusing. It's hard. Who wants to call somebody and say, hey, I'm having some suicidal thoughts. We've never talked, but can you get me an appointment? That's awkward. I get that. It really is. This is going to be focused on rural areas. So if you're watching me from a metropolitan area, I apologize. A lot of this is not going to be stuff you have to worry about. If you live in a rural area and you would like to start getting mental health services, especially rural areas in Iowa. I'm not sure about the rest of the country. Most of what I'm talking about is going to be issues here in Southwest Iowa. But if you are having concerns, obviously, if it's an emergency, please call 911 or go to the ER. If you're just ready to start broaching the topic of getting treatment, my first suggestion would be to set up an appointment with your primary care provider. Um, Living in the city, I would not say that, but here's why I say it about living in a rural area. Um, Most psychiatrists and therapists in rural settings, like the one that I live in, are there just aren't enough of them. I'm gonna be frank. There's not enough of them to go around. Not their fault, obviously. They're doing everything that they can, but it could be 3 weeks to 2 months before you can get an appointment with a therapist or a psychiatrist. And if you are ready to take that step, I really want you to go ahead and take it now instead of waiting that long, because in 3 weeks, in 2 months, you could feel completely different. So if you are ready to take that first step, go to your primary care doctor. Um, they aren't as specialized in mental health, but they obviously have some training, and they can help maybe get you started on, some basic medication, or even maybe help get you in to see another provider for psychiatry therapy faster. They might have some strings to pull, they might not. But let somebody know, get on the radar, talk to your primary care doctor. I mean, being able to get in the next week versus in the next 2 months. Obviously, timing is a big thing because you're not. Okay, speaking from personal experience, just because you're ready today doesn't mean you're going to be ready tomorrow. So, let's talk to your primary care doctor. There are some pros and cons to that. Obviously, they aren't as specialized as a psychiatrist or a therapist, but like I said, they are definitely a good starting point. I found a statistic through the CDC that 20% of medical visits with primary care doctors in some context address a mental health issue. So it is not going to be abnormal for them. You're not going to be, anything out of the ordinary. It's always a good place to start. After we're obviously, primary care physicians are a good starting point, but I want to talk about types of care after that, or if you're very lucky that you could start with earlier, and some of the differences between them, because a lot of the questions I've been getting are, so-and-so has a psychiatrist, but they don't do any counseling or whatever. So I'm going to talk about who does what. Psychiatrists in rural areas, not enough of them. I'm going to say that about every type of mental health professional. We need more. So if you are looking for a nice, quiet place to live and you have mental health experience, please move to Southwest Iowa. I would love it very much. Anyway, psychiatrists, they diagnose. They can, diagnose mental illnesses, and they provide medication management. So if you have, I don't know, other medications from your doctor, or if you're taking several medications for your mental health issues, psychiatrists manage that. They keep an eye on interactions between drugs, side effects. That's what a psychiatrist is going to do for you. Psychiatry. Yes, I think seeing a psychiatrist is a good thing. It is going to take you some time to get in there. But after you've seen your PCP, please set up an appointment with a psychiatrist. And I know you're thinking, well, my primary care physician prescribed an antidepressant. What do I need a psychiatrist for? Again, they do this all day, every day, in and out. They have literally all mental health experience. That's what they do. Your primary care physician isn't, I'm not saying they're not qualified to do a good job, but what I'm saying is that their focus is on your physical health. Your psychiatrist can focus on your mental health. Specialized care always comes with, benefits, and there's no reason that you don't deserve that. So don't be afraid to reach out for it. Therapy is, going to be like talk therapy, counseling, that kind of thing. Most of the time here in rural Iowa, if you're going to a therapist, they are not going to be able to prescribe your medication. They have different licensing. For example, licensed independent social workers do a lot of therapy, but they don't have a medical degree, so they can't provide you with medication, even though they can do psychotherapy. So while it's frustrating to have to go 2 to 3 different places to get treatment for the same thing, please don't be afraid to do that, because every piece of that is important. Personal experience, professional experience, research, everything I've come across says that the best possible treatment for mental illness is the combination of therapy and medication. I don't want to be offensive, so I'm trying to think the best way to say this. Not every therapist and not every psychiatrist is going to be good for every patient. I'll be honest, I tried 3 different therapists before I found one that I liked. I've also tried, how many psychiatrists have I seen now? 3 maybe? Yeah, 3 of each, before I found one that I really liked and that I stuck with. So I was living in the city though, which meant I had more options. If you live in a rural area, finding one of those and managing to get an appointment is going to be hard enough. So if it doesn't work out, if they're not a good fit, I understand that it's going to be really overwhelming to try to go back again. Make those phone calls, find someone that takes your insurance, get an initial appointment set up, go in and bare your soul to this person you've never met. I mean, that's really hard to do. And when you have very limited options anyway, it is hard. I'm not going to tell you it's not hard. If you live in Southwest Iowa and if you would like assistance in finding services, I'm happy to do that. I would love to get more familiar with the providers here. So if you want to say, hey, I'm having these symptoms, I have such and such insurance, I'm not sure where to start, here's where I live, I'm happy to research and give you some options of places to call. I can't promise to find one that's a good fit for you, but I'm happy to call an office and just say, hey, I don't need anything, but I just want to know if you're taking new patients. That doesn't bother me. I will make phone calls like that all day. So, start with your primary care physician because they're going to be able to get you in and they're going to be able to at least get you some basic care until you can get in with a therapist and a psychiatrist. So hopefully that helps explain the difference between psychiatry and therapy a little bit because that's been a big question I've been getting. In addition to how do you even start? So a lot of that is overwhelming. I just threw a lot of information at you and I did it in a way that was probably not very organized. So if you have any more questions, don't hesitate to reach out. Another question that I've been getting a lot of that I just kind of want to touch base on kind of falls into that category with starting treatment is expecting what to have. I'm sorry, I'm a little bit tongue-tied today. So where to start, but also what to expect from those initial appointments, from that treatment. How is it actually going to help you? I'm going to be honest with you, starting with psychiatry and medication can be challenging. It's a lot of trial and error with medications, and that can get frustrating. You start something new, you have a lot of side effects. Sometimes they give you medications to deal with the side effects, which cause more side effects, and you're adding in tons and tons of stuff. Sometimes they just don't work in general. A lot of things can go wrong, and it takes a lot of patience. I'm going to be honest with you. I started taking medication in college in 2013, I think, and my psychiatrist and I are still tweaking my medication regimen today, trying to find the right balance. I think we're pretty close, which is awesome, but I'm also aware that that doesn't mean it won't change in the future. I have tried and withdrawn off of several things. It's not a fun process. But again, it is worth it. It's not easy, but it's worth it. Therapy. A lot of people seem to be under the impression that they can start seeing a therapist. They go in, they talk with the therapist, and then they're supposed to just get better. And I'm going to tell you that's not how that works. Therapy is hard. Therapy is work. Therapy, especially good therapy, is going to push you to do things you're not comfortable with. And that's a good thing because there are things you probably should be comfortable with that you're not, which is why you're there. My therapist, well, the third one I tried, absolutely love her. She's fantastic. She would give me homework, and I would have to practice doing things that made me really uncomfortable. They made me feel really awkward, and I had to really work at it, but those things helped. It's kind of like physical therapy. Just showing up isn't enough. You have to put in the effort. And people are often not expecting that with therapy. So I just want people to be aware of that going in, that it is going to be a process. You're going to have to put effort in to get effort back. Well, what you put in is what you get out of it, is what I'm trying to say. And I wish there was an easier way to do this, because I know when you're feeling like you're not mentally stable, the last thing you want to hear is starting treatment is going to be a lot of trial and error and a lot of hardship and a lot of crap in the beginning. And that's not ideal. I know that. Um, so obviously, getting treatment is a difficult process. There are a lot of hoops to jump through. It's hard. It's not something that's going to happen overnight. So in addition to starting out by talking to your regular doctor and getting established with a therapist and a psychiatrist, at least in my opinion and experience, the biggest thing that you can do is to build a support network. And I know that sounds easier than it is, but when you have people that go through the process with you, that are willing to talk to you about how you're feeling, about the effects of your medications with you, go with you to appointments when you're nervous, even, that is the single biggest thing that will get you through that treatment. I can honestly tell you that if I hadn't had people supporting me, I would have quit treatment almost immediately. I mean, it was too hard for me to do on my own. So that is the biggest thing that you can do for yourself, in addition to actually getting those treatment processes started. So with that comes my advice for the people who are watching this on behalf of someone else. We live in Iowa. We live in Southwest Iowa. We don't talk about our feelings. We talk about the weather and what's wrong with somebody's tractor. We don't talk about mental health. So if you are concerned about someone you care about and you want to help them get treatment, you want them to be able to have the resources to get better, I'm asking you to step outside of your comfort zone and to experience what they're experiencing with them, to be willing to go through all that awkward stuff with them, because as awkward as it is for you to talk about, I promise it's a million times worse on their end, and they're trying to do it alone. So the more we can get used to having these conversations, being open with each other, have support, ask for support, be a support, don't be judgmental, just be there for each other. That is the single best thing that is going to help somebody get better. So I hope that makes sense. I hope that helps. If you guys have any more questions, or if that was confusing, because that was super unorganized, just kind of rambled it all out at you. Don't be afraid to reach out. Please let me know. Again, I'm really happy that people are reaching out to me with private questions. Don't be afraid to do that. Don't be afraid to post them publicly if you're comfortable doing that, because I'm sure if you want to ask, there are at least 10 other people who are too scared to. Talking about this needs to be a more normal part of life, and it starts with little conversations, one person at a time. So be willing to be one of those people.